After viewing this video, you will be able to safely handle soiled linen, safely dispose of medical and non-medical waste, clean high-touch surfaces, clean the operating room table, clean the operating room floor, and accurately check and inspect your work. The circulator generally gives direction to enter the operating room once the case is over and the room is clear. When directed, move your cart to just outside the operating room that you will clean. Don't roll your cart into the room. Stage it just outside the door for the cleaning process. Remember, this cart and equipment is for operating room cleaning only and should not be used in any other area of the hospital. Your personal safety is of the utmost importance. Always wear the appropriate personal protective equipment, such as scrubs, shoe covers, hair covering, and a mask with eye protection. All jewelry and personal effects should be left in your locker. Remember to thoroughly wash your hands and arms before entering the operating room to prevent possible shedding from your arms. A recommended alternative is to wear a long-sleeve warm-up jacket that is buttoned or snapped closed. Once you have put on a fresh set of gloves, you are ready to enter the operating room. The operating room door should remain closed while you clean the room. Begin by rolling a Rubbermaid linen hamper up to the operating room table. Fold the linen corners into the middle of the table, forming a small bundle. Lift the bundle so it does not touch your body and place it into the linen hamper. Remember, treat all linen as though it could contain sharps or medical waste. After securing the top closures, pick up the used suction container from the suction carousel and place it into the kick bucket. The kick bucket should be double-lined with red medical waste polyliners. Gather the inner liner, roll the outer liner down, and securely double-tie it before removing the liners from the kick bucket. Always carry waste away from your body. Lift the liners and take them out of the operating room to the central pickup point for medical waste. Remember, always treat every bag of waste as if it could have a sharp object in it. Reline the kick bucket with 2 red medical liners. We recommend a Rubbermaid Lobby Pro dustpan and cleaning wand to gather and pick up any large debris on the floor. The squeegee wand is preferred over a traditional broom in an operating room for several reasons. It does not cause any small particles to become airborne. It is easier to clean and disinfect than a traditional broom. And it can gather and pick up both wet and dry waste. Once all of the debris is collected into the dustpan, it is easily dumped into a Rubbermaid step-on container that has been lined with the red medical waste bag. Now it is time to gather all other waste from the operating room. Start by picking up any trash around the waste containers. After all the trash has been picked up, roll the polyliner closed and double-tie the top for disposal. Remember, never compress the waste materials down into the container with your hands. A sharp item could be in the waste container. Always treat all waste as if it contains sharps. Handle waste for the least amount of time possible and carry the bags away from your body. After emptying a waste container, reline it with the correct size and color polyliner as directed by your supervisor. Secure the liner in place by tying a knot in one of the corners. Don't mix general polybagged waste, which is identified by a see-through or translucent liner, with red-bagged medical waste. These 2 types of waste are handled by your facility in different ways at very different disposal costs. High-touch areas are areas that are frequently touched and could be a source of cross-transmission. For the high-touch areas, we recommend the green microfiber cloth. Remove the green and red 5-quart pails from the top of the cleaning cart and carry them into the operating room. These color-coded pails contain the red and green Rubbermaid hygiene microfiber cloths. These cloths have been pre-moistened in cleaning solution. Directions for preparing the cloths can be found in the cart preparation chapter of this DVD. Remove a green microfiber cloth from the green pail and wring out any excess cleaning solution. Starting with the overhead arm, reach up to the point farthest from the light and wipe down all the surfaces with the green cloth. Pivot the light fixture so that the top surface is facing you and continue the cleaning process. Be sure to turn and fold the cloth frequently for optimal cleaning results. Do not be surprised if there is blood or other bodily fluids on the light. If these fluids are present, scrub the area to thoroughly clean the surface, frequently turning the cloth to a clean side. Continue to clean all the areas of the light that the surgical team may have touched. Repeat these steps on the second overhead light. Continue using a green Rubbermaid hygiene microfiber cloth to clean the work tables and Mayo stand surfaces. Frequently turn the cloth using the 8-sided fold method. Details of the 8-fold method can be reviewed in the Rubbermaid Hygiene Product User Manual. You will only wipe down the top surfaces of the tables when cleaning between cases. Use smooth side-to-side wiping motions for complete surface coverage. The table legs, casters, and underside of the table will be cleaned during the daily terminal cleaning process. However, if these areas are visibly soiled, they should also be cleaned. Never place a used microfiber cloth back into a pail, as this could be a source of cross-contamination. When finished with the cloth, place it in the linen bag for laundering. We recommend a red Rubbermaid hygiene microfiber cloth to clean the operating table. To effectively clean the operating table, you will need to disassemble and move its attachments to thoroughly inspect and clean all of its surfaces. Start by inspecting and wiping the top, sides, and bottom of the table pads. Be careful not to stack a cleaned pad on a surface that has not been cleaned. Next, wipe down the top and bottom of each removable component as you lift it from the base. Always wipe the area of the bed beneath the removable platforms before you reinstall them. With some practice, this process becomes second nature. Remember, frequently turn the cloth during the cleaning process. After cleaning the surface of the operating table, work your way down to the table's base. Thoroughly wipe the underneath side of the table. Continue down the base of the table, remembering to clean the legs and casters. When you are finished with the operating table, put the red microfiber cloth in your laundry bag and return the pails to the cleaning cart. To clean the operating room floor, we recommend the Rubbermaid Pulse Mopping System. For directions on preparing the Rubbermaid Pulse Mopping System, refer to the cart preparation chapter of this DVD and also in the printed Product Use Manual. Place a safety sign in the doorway of the operating room. Move the operating room table so that you can clean the floor beneath it. Dispense cleaning solution from the Pulse Mop onto the floor by depressing the red trigger button. Pull the mop through the liquid to adequately wet the mop, and begin mopping with overlapping figure-8 strokes. Pay particular attention to the area around the operating table. Work your way back to the door, being sure to cover all the floor surface. If the mop becomes dry, depress the red trigger button to re-wet the mop as needed. Use only one damp mop per operating room. When done, remove the mop and place it into a Rubbermaid laundry bag. When the floor is dry, remove the safety floor sign and place it back on the cart. Take a final look at the room to check for any spots that you may have missed. As you look back over the room, review your cleaning process checklist to ensure that you have not missed a step. A green Rubbermaid hygiene cloth is perfect for last-minute touch-ups on frequently touched items like the phone, light switch, wall-mounted panels, and door handles. Remember, never place a used cloth back into a pail due to the risk of cross-contamination. Always place used cloths in the linen bag for laundering. Properly remove and dispose of your personal protective equipment. Let the circulator know you have completed the between-case cleaning of the operating room. Before moving to the next operating room, be sure to thoroughly wash your hands. Hand washing is one of the most important things you can do to reduce the risk of cross-transmission. Wet your hands thoroughly before applying soap. Lather your hands, wrists, and fingers with soap for at least 20 seconds. Rinse all surfaces of your wrists, hands, and fingers. Finish by drying your hands and wrists with a clean, dry paper towel. Dispose of the towel. Your facility may have different cleaning procedures. If you have any questions, ask your supervisor.